When Florida Panther players hear a snap, crackle, or pop, he's the man they come limping to. We'll ask how he keeps players fit on the ice. Up next on Comcast Newsmakers.
Bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Welcome back to Newsmakers. NHL players can suffer from an assortment of injuries, but those same injuries can affect weekend warriors too. This hour's newsmaker is orthopedic surgeon Dr. Al Desimone. Welcome to our show. You are the official orthopedic surgeon for the Florida Panthers.
Yes.
You must be excited hockey season's finally starting.
Yes, I am.
You waited like an entire year for this to happen.
Yeah, we had an off season, so I'm looking forward to getting involved and interacting with the team and the coaches.
What type of injuries do you see from Florida Panther players and any type of hockey player?
Well, a lot of the injuries evolve around bumps and bruises, sprains to muscles and ligaments. Commonly, I'll see a number of the athletes having injuries to the shoulders and knees, as well as the hip region.
And you see similar injuries as far as weekend warriors are concerned too. I mean, they don't have to be on the ice to actually get these things.
No, they don't. They don't. I usually, I'll see very commonly similar injuries in my office when it comes to the weekend warriors because, and maybe even a significantly higher incidence of injuries because of their lack of training, lack of flexibility, which I think is very important.
Let me ask one question. Someone tells me that if you stretch very well, stretch and be very limber, you have less of a chance of getting injured. Is that correct?
Yeah, I think it's extremely important to develop good training skills. Flexibility is very important when it comes to preventing injury. Agility, stretching, strengthening of the muscles. I think that's all imperative when we're trying to prevent injuries on the field or on the ice. Also proper nutrition and proper hydration also prevent from further injuries as well.
Really, that all goes to joint health.
Yes, it does.
You brought a model in here, and this is kind of interesting. This is a model of a knee, and this outside, what is this here?
This is the front of the knee. Here is the patella, which is the kneecap, and here you have the quadriceps tendon. Some of the tendons, here is also the patella tendon, and if you open the knee, which we can here, we could look at the inside of the knee, and this just allows us to see the end of the thigh bone. You could see the cartilage gliding surface here, and then you can also see the menisci or the cushions that help protect the knee, and they actually allow for stability and lubrication of the knee.
And this thing right in the middle here, that's the ACL.
That's the ACL.
The dreaded ACL, everybody gets sometimes torn.
Sure, that's the most important, one of the most important structures within the knee. Not only it is the strongest ligament within the knee, but it also prevents rotation and prevents stability.
What are some of the biggest advances you've seen as far as repairing knees without replacing a knee totally?
Well, the great thing is that we've come up with lots of techniques that are highly technical. They're minimally invasive approaches. We can do pretty much most procedures in the knee through minimally arthroscopic approaches. We could look through a microscope, make small incisions, and bring everything into the knee and pretty much reconstruct whatever we need to reconstruct or repair the meniscus as needed.
And without really filleting the knee, so to speak, just going ahead and cutting the knee totally and doing work that way, you can go in arthroscopically for almost any knee type of operation.
That is correct.
Now, what are some of the most common knee problems you see, not only from hockey players, but also weekend warriors?
Sure. We see injuries to the cartilage surface, the gliding surface of the ends of the bones. That's the hyaline cartilage that protects the ends of the bones. Sometimes you could bruise that or injure that. We also see injuries that involve the menisci, which are the cushions that support the knee.
Okay.
They actually add in stability, and they provide lubrication and proprioception for the knee joint.
All right, well, thank you very much. This hour's newsmaker has been Dr. Al Desimone discussing common sports injuries.